Hello and welcome to Maverick's birth story video. I've been putting off this video for so long now because he was born the week before Thanksgiving and it's now Valentine's Day. I just want to put this video out there, not only like for my own keepsake and memories, but also just to help anybody out there that's going through a pregnancy complicated with IUGR, because I know like from my own experience how scary it is, and just like there's just so many fears. I just want to put like a positive video out there on the internet so that you can have like encouragement and hope, because we had a really great happy ending. Maverick is now 2.5 months old, actually almost 3 months old. He's doing so wonderful. He's gaining so much weight. He's gaining about 1 pound a week and he's just thriving. There is hope if you are like frantically searching the internet for experiences. I know whenever I found out about his issues, I searched YouTube and I just desperately wanted to find out other people's stories and what they went through. And you know, there was a lot of sad stuff that I found, and it just caused like more anxiety for me. I've never experienced more anxiety in my life than during pregnancy and labor and delivery, and I just was constantly fearing that like my baby's gonna die, something bad is gonna happen, like all these negative thoughts. But I'm gonna move on. This is a happy story and I hope it helps you out. So if you don't know what IUGR is, it's Intrauterine Growth Restriction. It's basically when your baby isn't growing properly inside of you, and they're usually born looking really malnourished and tiny and skinny. I'll insert a picture of like a normal baby compared to an IUGR baby at like the same gestational age, because it's pretty incredible the difference. Like an IUGR baby looks like a preemie baby. Like he was in preemie clothes and he was born like basically full term. I mean, he was 1 day off from being full term. So before I get into the actual like labor and delivery part of things, I want to give just like a brief background of the pregnancy. So when I was 27 weeks pregnant, I came in for my appointment. I remember like the nurse saying like how small my bump looked, and I had been hearing that for so long. You don't even look pregnant. I remember just feeling like bloated and like feeling like I was pregnant, but like nobody else could see it, and it kind of bothered me because when you're pregnant, like you just want to finally look pregnant. But anyways, 27th week appointment, she measured my bump. It's called like the fundal measurement. It's supposed to match the baby's gestational age. Well, I was measuring like 2 weeks behind, I think, so that was kind of a call for concern, and she wanted to do an ultrasound the following week just to make sure like everything was okay. When I went in at 28 weeks, I'm just gonna read what she wrote in the charts. Small abdominal circumference, otherwise normal parameters. Follow-up planned for every 2 to 4 weeks to confirm continued appropriate growth. And at that point he was in the 23rd percentile, which is again tiny, but you couldn't call him an IUGR baby yet because he technically wasn't underneath the 10th percentile. And she kind of suspected something was wrong at that point. It didn't make sense for me to have a small baby either. Big babies run in my family. My brother was like 9 pounds, I think. And seeing how fast Maverick is like jumping the charts now that he's out and thriving and like drinking milk and getting big. He's actually waking up right now. Or if I would have had a normal pregnancy, he would have been a big baby. But he wants to say hello. Say hi, Maverick. You just woke up from your nap. Basically that day I came home and I was so worried, looking up, why does my baby have a small abdominal circumference? That's pretty concerning. And of course like things come up about IUGR, and I just kept reading and basically scaring the heck out of myself. At 33 weeks we did another ultrasound, and once again small for gestational age. However, he looked healthy otherwise. He had normal heart rate, he was moving and kicking and whatnot. She scheduled another ultrasound for 2 more weeks. So once again I knew in the back of my head, okay, something's still not looking right here, because she wouldn't be monitoring him so closely if there was no issue. So then at 35 weeks, fetal growth parameters appear normal except for the abdominal circumference, once again, which continues to measure smaller than expected but consistent with previous measurements. The fetus continues to measure smaller but is still over the 10th percentile, although abdominal circumference has decreased to the 2nd percentile. again, it was so scary because you don't want to think that like your baby's inside of you starving. His stomach was getting smaller. That's not normal. Babies should be consistently growing bigger and bigger, especially at the end of your pregnancy. They should be gaining weight in pounds every week, you know, like I think it's like a half a pound a week or something. So then at 36 weeks, I came in thinking I was gonna have another ultrasound to like measure things, but it was just an ultrasound to check and make sure that he was alive and well. Sorry, I'm gonna have to bounce. I guess you can only measure every 2 weeks. Everything looked good. His heart rate was good. He was moving once again. Actually, that week I got a phone call and it was the doctor's office. It was the nurse and she said, "Hi, I was just calling to inform you of your induction." And I was just like shocked. So then when I went to my next appointment, we did the growth ultrasound, and as soon as we were done with that, she said, "I'm gonna go ahead and make a phone call to the hospital. We want to go ahead and get you in. I think it's the best idea to get him out as soon as possible. There's no reason why he needs to stay inside of you anymore, blah blah blah." Well, she didn't tell me until I was at the hospital. He had stopped growing for 2 weeks. He had not grown at all. And I'm actually kind of glad she didn't tell me that, because that would have freaked me out for those 2 days. Also at that appointment is when she finally charted intrauterine growth restriction. I remember just like breaking down into tears once I finally got that confirmation that yeah, he does have IUGR. It was like the scariest feeling in the world. So once I got to the hospital to be induced, they immediately started me on Pitocin. They inserted a Cook catheter, which is 2 balloons, one that sits on top of your cervix and one that's underneath, and it's meant to like put a bunch of pressure to like open you up, because I wasn't dilated at all. I guess I was kind of in denial that morning. Michael and my mom were telling me like, "You're gonna have a baby today." And I was just like, "No, Mom, like you don't know that. I could have a baby tomorrow." And my mom just looked at me and she's like, "Katie, they induce you because they want to get this baby out." They were increasing my Pitocin every 30 minutes and things were progressing fast. Contractions were getting closer together and stronger. And then around 12 o'clock, my water broke. And then I think after that, things were progressing like even faster. I ended up getting the epidural at like 5 or 6 centimeters, I think. And then later, I don't remember what time it was actually, he started having heart decelerations. And my doctor had warned me, you know, with IUGR babies, they don't tolerate labor very well. She was kind of preparing me like, you might have to have a C-section. I remember like 2 nurses rushing in. Like there was one on each side of me and they were like looking at the monitor, looking at me, moving me around. They're like, "Turn, turn, turn." And I had the worst anxiety of my life, but then there was also a part of me that was like, I need to stay calm as I can. I need to take deep breaths, because when you're breathing, you're giving oxygen to your baby, which is keeping him alive and well, and he needs you to stay strong for him. They'd get me into like a certain position, and I think like sometimes it would get a little bit better and then like it would go down again. So they shut off the Pitocin, and sure enough, as soon as they shut off the Pitocin, contractions stopped. So did his heart decelerations. Like he was doing a lot better basically. I forgot to mention that I also had an amnio infusion. I think it was actually due to the heart decelerations. They thought maybe that would help. See, this is why I should have made this video a long time ago, because now I've forgotten things. So the doctor ended up coming in and she just said, "Look, you know, things aren't looking so good. Your baby's not tolerating contractions. I think it would be in your best interest to go ahead and do a C-section and just get him out." I was not prepared to hear that. I went in there determined to have a normal labor and delivery. C-section wasn't even like in my thoughts, because I just thought that that's never gonna happen. I basically told her, you know, I'd like to wait just a little bit longer, start up the Pitocin again, and just see if he'll do better, because his heart was fine, which is because I wasn't on the Pitocin. Sure enough, when they started me back up on the Pitocin, his heart rate was going down again. They shut it off. Doctor came back in and mentioned the C-section. At that point, I was so just like ready to have him out. I was so defeated. I was so tired, worn out. I remember like just having so many anxiety attacks during labor and I would like call my dad or like call my brother, just hoping I could find comfort from someone. Really, God is the only one that could have comforted me truly in that moment. And I remember my dad praying for me, and I just felt peace in that moment. But it was just a constant fight of like fear and faith, fear and faith. So I was like, you know what, go for it, get him out. I couldn't be with my mom and Michael at that point. When they took me back into the room, I was by myself until a little bit later they let Michael come in. I could only have one visitor. I'm not gonna go into like all the details, except for I do want to mention I felt like I couldn't breathe at one point. She even told me like putting the medicine in, she's like, you know, it's gonna feel like you can't breathe for a minute, but I assure you, you are breathing. Not being able to breathe is like my worst fear. So just like on top of everything else, now I can't breathe. It was not funny like in the moment, but now looking back, I'm just like, oh my gosh, there was just so much going on. At some point, they finally let Michael back in and they started the surgery. It was a really bizarre feeling, being numb, but then also feeling all of like the tugging that they were doing, and it was just an odd sensation that's really hard to describe. They said, okay, like you're gonna feel a lot of pressure. I don't even know that it was like pressure, it was just a weird feeling. The process of like getting him out was actually really fast. I remember them saying, oh, here he is. Whenever he came out, I heard like the cutest tiny little cry. You know how some babies come out and they're like, wow, like screaming? It was not like that. It was just so quiet and meh. And then I couldn't hear him cry anymore. And I was like, why is my baby crying? Is he okay? Is he okay? And then one of them said, he's fine, he's fine. We're just helping him breathe right now. And then they're like, Dad, do you want to come see him? He got to go see him before I got to see him. I guess that's a special thing that Michael can say. Once they got him like breathing good and whatnot, and did like whatever tests they did on him, they like bundled him up really good and brought him over to me so I could see him. And oh my goodness, it was just like the best feeling in the world to see him there. He wasn't hooked up to anything. He didn't need help breathing at that point. He was just a perfect little tiny teeny angel. He was only 4 pounds 10 ounces. At that point, I still wasn't even able to hold him. It surprised me how long it took for them to like sew me up and everything. I kept asking like, are you almost done? Like, I just wanted to see my baby. Fast forward to when they sent me to the recovery room. They finally brought out my baby and I got to hold him, but the pain started kicking in. These people gave me fentanyl. I had never had that before, obviously. Never again. It was the worst, weirdest feeling I've ever experienced. Man, I was pretty loopy, but they told me since he was under 5 pounds, he had to go to stay in the nursery overnight. They told me usually C-section moms can pump in their room and then someone will feed your baby for you down there, but you can go down there if you want. And I was determined, like, I want to be with my baby. I don't care how much pain I'm in. I'm getting in that wheelchair and I'm going to see my baby and I'm going to feed him myself. And I sure did. Every 2 hours, I think they let me go and see him and be with him. But yeah, I think that's all I really want to get into. I have more stories about like afterwards, like finding out that I was allergic to something that they gave me. My nurse didn't know it. She was like, oh no, it's just from the epidural, it's normal. She gives me more and then like my nose starts closing up. It was a mess. We had to stay at the hospital for a few days because they had to make sure that he was gaining weight. He actually lost some weight at first and then he started gaining weight. Then we were finally able to take him home once they confirmed that. And yeah, that's this story. Hopefully this video gave you some hope if you're dealing with IUGR. It's super scary, but I just want you to know that if you turn to God and just pray through everything, be at peace and just trust in Him, He will honor that. And I just give all the glory to God because He had His hand on me and Maverick that whole time. Things just turned out wonderfully and He is just the perfect little miracle angel. It's so fun to like finally hear people say, or they ask me, how old is he? I'm like, oh, he's 2.5 months old. And they're like, what? He's so big. It's such a good feeling to finally hear that because all I heard before was, oh my gosh, he's so tiny. But now he is fat and happy and growing. So I guess that's the end of this video. Thanks for watching. Bye. Say bye, Maverick. Say bye.